Hi everyone, it's board certified plastic surgeon Sean Doherty from Boston, and I've been asked by my patients and viewers to talk about fillers and just kind of clarify what they are and what they're used for. So what is a filler? So a filler is a gel-like substance that it's injected underneath the skin in the face, for the most part, to improve volume, to improve lines, to improve the overall rejuvenation of the face. That can also include the temple, underneath the eye, the jawline, the chin, along the neck, and then also in the hands. So fillers are made out of a variety of substances. The most common substance is hyaluronic acid. Hyaluronic acid is a product and a protein that's in our body. It's in our connective tissue. Its role is to hold on to fluid and to hydrate. And so that's how the gel kind of does its thing. The gel sits underneath the skin and volumizes. Hyaluronic acid you might know as a product that's in some of the things that we put on our face because it hydrates and volumizes our skin from the outside. Besides hyaluronic acid is calcium hydroxylapatate, which also is a product that we have in our body. It's part of our connective tissue, our bone, cartilage, etc. And it volumizes in a different way. And then lastly is polylactic acid, which is more of a biostimulant, and it's a product that's injected underneath the skin and other parts of the body besides the face for volumization. It's done in series, and it's not a gel that breaks down, but a stimulation product. And I'll probably talk more about that in another video. So some of the groups of products are the Juvederm family, and that's made out of hyaluronic acid. The Restylane family is also something that you might be familiar with, also hyaluronic acid. Radiesse is made out of calcium hydroxylapatate, and that is another product. So what are the benefits of these products? The benefits are that they are easily injected into the skin, and they are, for the most part, not permanent. Any of the products that I inject or I'm talking about today are non-permanent products and can have a balanced, safe, kind of healthy, subtle improvement when used well. The benefits of hyaluronic acid, which again are the Juvederm and Restylane family, are that the product can be dissolved. So hyaluronidase is an enzyme that can break down exogenous hyaluronic acid. That means injected hyaluronic acid. It's an enzyme that can break that down. And that is an important thing if filler is injected in a place that doesn't have the best cosmetic improvement, or if it actually has a medical consequence. So if a filler is injected near or in a blood vessel, then the skin that's supplied by that blood vessel might be affected. And that's important in the nose, in this area, along the nasolabial folds, and in the lip area. And that's an emergency, and that's a significant complication with fillers, and you want to make sure that your injector understands how to do that and understands how to take care of that. And I'll be sure to talk about that concern and ways to prevent that from happening in future videos. So what filler goes where? Well, in general, the thicker, heavier fillers go in the mid-face and along the jawline, because here I'm trying to lift up, and here I'm trying to emphasize the jawline and emphasize sort of the chin. So products for good effects there are my bigger products. So Voluma from the Juvederm family, Restylane Lift or Restylane Define from the Restylane family, and then Radiesse is very good for along the jawline. Other areas have more of a subtle need, and then that's where the smaller products, the less robust products, are placed. So other Juvederm or Restylane products are placed along the nasolabial fold, perhaps along here, in the temple. The thinnest, most subtle fillers are injected along the tear trough, which is here to improve the shadowing there. And then the medium fillers are typically placed in the lips to give some volume. More robust fillers tend to be placed in the hand. So the procedure for fillers lasts about 15 or 20 minutes to do the procedure. I wouldn't say it's completely pain-free, but it's fairly tolerable. I usually wash a patient's face after they've removed makeup, and then I'll wash it with alcohol and then something called chlorhexidine, and which will sort of sterilize their skin and make the procedure a lot more safe for the patient. So after that, the filler is injected with a needle underneath the skin. There's a small pinch. Oftentimes the filler is mixed with numbing medicine, which is called lidocaine. Then again, it takes about 15 or 20 minutes to do the procedure. It's also often combined with other procedures like neurotoxin injections, which are Botox or Dysport. The patient could be swollen in an area for a day or so. I ask them not to exercise for the first 24 hours, and I ask them not to massage or manipulate their face, so they wouldn't have a facial or a massage or any type of facial treatment for about the next 2 weeks. Typically, there's not a lot of discomfort after the procedure, though sometimes people might have a little bit of an ache along the bony areas like the jaw and the mid-face, and they take an anti-inflammatory non-steroidal for that first night. So the effects, people want to know how long these last for. Depends. Some people metabolize filler faster than others. In general, I would say that filler can last between 8 to 10 to 12 months. I think some people get longer out of that. It depends on where the filler is placed and which filler is being placed as well. In general, I ask my patients to come and see me every 3 to 4 months for neurotoxin. And then I say every second visit, so every 6 to 8 months, we assess the need for some type of filler. A great way of doing filler is to volumize the face, kind of get a nice improvement, which could require multiple syringes. And then there's maintenance of that. And so then every, say, 6 to 8 months, you're considering touching things up and never having to have a huge amount of filler placed at one time. I have to say I'm a pretty subtle guy, and so I don't like my patients to have any overdone look. And so typically an initial injection with me for, say, this area and this area is between 2 to 3 syringes. And the filler is injected with a needle. So this is what the filler looks like. A needle is attached, and then the needle is injected through the skin and the filler placed that way. Another option for filler injection is actually with something called a cannula. So this is blunt. So this actually doesn't hurt. I make a small poke with a needle in the cannula goes underneath the skin and leaves the product underneath that with less sort of swelling and discomfort. And it's good for areas underneath the eye and around the lips. So I talked about a lot of stuff today. I hope this was helpful. I will speak more about each of these treatment areas and products in the future. So please stay tuned. Thanks.